So when we think about treating patients with cancer, we have the capacity now to look at their cancer at the molecular level. There's several different tests that can be done, looking at the DNA and doing gene sequencing, looking at the proteins, and looking at something called phosphoproteins, which are the activated proteins that are actually driving the cancer cell. And the testing platforms allowing us to do these have become actually to the point where they're now a retail service and allow us to do very broad-based analysis. The reality is that no one company could do all of the testing, and that's where Perthera comes into play. So we have the capacity to do a broad-based molecular analysis that's multiplex, which means that we bring a patient's tumor into our facility and then get it sent out to the different retail companies that do different kinds of molecular tests and give us the full spectrum of the patient's tumor. Once these analyses are done, we can then bring it back in-house and do the analysis in conjunction with the patient's history so that we get the best understanding of what the patient's been through and what's driving the patient's cancer at the molecular level.